نبدأ إن شاء الله. السلام عليكم ورحمة الله. مساء الخير جميعا. It's my pleasure to present an introduction about otolaryngology and head and neck surgery. Special thanks for organizing committee for their work. It's very great work and helpful for every intern to just map or to plan his 12-month journey in the internship. So I will talk about otolaryngology in a few slides. I will go through what's ENT specialty, and how's the training in ENT. So otolaryngology is a specialty concerning about the ear, nose, and throat, head and neck area. In the throat, I want to emphasize that upper esophagus, oropharynx, hypopharynx, supraglottic, glottic area, those area involving in concern of ENT doctor or otolaryngologist. Due to limited exposure of ENT in mid school, details of exact what to be an otolaryngologist is lost in many students and doctors. So, what's truth about the ENT, and what's the truth to be an otolaryngologist? Actually, the specialty or subspecialty in ENT is huge, and variety of specialty in ENT is huge. For example, we have maybe like 7 or 8 subspecialty, and each subspecialty need special skills. For example, an otolaryngologist must be able to perform macroscopic surgery, like macroscopic surgery of the ear, and endoscopic surgery like this one, if you can see my pointer, endoscopic surgery of nose and paranasal sinuses. Also, the microscopic surgery of head and neck and microscopic flap, as well as laser surgery and robotic surgery. So imagine that you need to at least to get knowledge or to gain some skills in these at least 5 variety of the approaches to the nose and ear and throat. And also imagine that the procedure can be vary from less than 15 minutes in Botox injection of focal cord spasm to exceed 12 hours of major head and neck surgery, for example, tongue cancer with head and neck dissection. So now I will go through each specialty of ENT in brief. I will start by rhinology, and as all we know, rhinology is specialty concerning about the nose and paranasal sinuses, and also the skull base, anterior skull base surgery. So the doctor and rhinologist are concerning about rhinitis, chronic rhinosinusitis, sinonasal tumors, septal diffusion, inferior turbinate hypertrophy. Those are the disease we face in rhinology clinic daily. Also, there's advanced specialty, which is anterior skull base surgery, concerning about the pituitary gland and tumor arising from anterior skull base. So the ENT doctor or rhinologist, they are dealing also with anterior skull base and pituitary. Uh, the second specialty is autology. Autology is very beautiful specialty in ENT and require precision and high level of surgical skills. It's very fine surgery. All the surgery done in autology by using microscope. The otologists are dealing with external auditory canal, the middle ear and inner ear, and there's an advanced subspecialty in otology, which is lateral skull base surgery. And lateral skull base surgery, they are dealing with temporal bone tumors like cerebropontine angle tumor, schwannoma, vestibular nerve schwannoma, meningioma. So it's very advanced specialty. And what I like about the otology is special because there is one procedure called cochlear implant. I think all of us hear about cochlear implant. Has highest number of quality of life improved years of all other procedure. Imagine that if you have a child with 2 years and he has complete hearing loss and he didn't develop any language, and once you do this procedure for him, he will start to gain a language, he will start to hear, and you change him from handicapped child to almost normal child. The third subspecialty is facioplastic surgery. Facioplastic surgery is cosmetic subspecialty concerning about the all face except the oculoplasty by ophthalmologist. We are treating or addressing the nose, addressing the nose, like if you have any deformity in the nose, we can do a rhinoplasty. If you have any deformity in the ear, we can do autoplasty. So it is a cosmetic procedure or cosmetic subspecialty. Head and neck surgery also it's important specialty in ENT. Those surgeons are concerning about thyroid, salivary gland, tumors, and neck masses. And all of the patient they will present with a benign or malignant tumor to their clinic, and it's very interested specialty. Uh, Thyroid surgery, as I said, salivary gland, and neck masses. Regarding the pediatric otolaryngology, we have a subspecialty in pediatric. They are dealing with congenital hearing loss, obstructive sleep apnea, airway issue in the pediatric, especially laryngomalacia. If you hear about laryngomalacia and other congenital airway disorder. Laryngology, the specialty dealing with the voice, the production of voice, and the quality of voice, and also sometimes they may find patient with neoplasm of the focal cord of glottic area. So, an otolaryngology is a surgeon and physician. So in our specialty, it's not on or always we have to operate on patients. Sometimes those patients, or maybe more than 50% of the time, the patient they will not need any surgery. They need medical management. They need follow up with medication and serial imaging if you suspect something to be followed. So outpatient clinic can be busy. You may see 40 patients at from 7 to 40 patients at per day, and in OR you may do like two day of OR per week, and I will talk about the on-call in the next few slides. So the demographic feature or demographic distribution of our patient, we are treating patients from neonate to elderly, even premature patient with airway disorder up to the elderly patient with malignancy. So we will see all type of patient from neonate to elderly. And ENT on call are varied, but generally manageable. Um, as I said, during the daytime it's very busy specialty during daytime in the clinic or in rounds or in OR. Out of hour work, if you are on call and you finish the daytime, generally quieter than other surgical subspecialty, but the main issue in ENT is the airway. So emergencies can be dramatic and life-threatening. Lifestyle of ENT offers make an attractive environment to the woman and flexible training program. Also, private practice work is available, but it's different from specialty to specialty and from the region to other region. What fellowship we have in ENT? We have, as I said, otolaryngology. We have medical subspecialty like allergy, fascioplasty, and reconstructive surgery, head and neck laryngology, rhinology, microvascular surgery, plastic, and pediatric otolaryngology. So I will talk in brief about our program here in Saudi Arabia. We divide our program into three stages. I will talk about it in next slide. We have promotion and BAFT exam. Promotion exam after each year. So we have 5 promotions exam and 2 BAFT exam. BAFT one, once you finish 9 months of ENT training, you are qualified to do BAFT one exam. And BAFT two after you finish the 5 year. We have mock exam in our program here in Nasir Central Hospital. We have what's called mock exam. We have at least 2 mock exam per year. It is a combination of OSCE and oral exam. And in the end of the year, we have OSCE exam as a part of promotion. So in first year, it's general year. You will go through the general surgery, for 2 month ICU, plastic anesthesia, ER, pediatric surgery, and you have one elective uh, subspecialty for maxillofacial or neurosurgery. And they add in this year the R1, they can join ENT for 2 months as introduction to otolaryngology. Regarding the junior level, which is R2 and R3, and the senior level are R4 and R5. Junior level, they will go to the general otolaryngology for 3 months, autology, rhinology, and head and neck for 3 months also, and he will get 1 month vacation. Regarding the senior level, maybe this is by mistake. R3 should be here with R2. Uh, Head and neck, autology, rhinoplasty. This is rhinology and fascioplasty in the senior level, and plus pediatrics, otolaryngology in senior level. So, if you are interested in surgical career but still want a balanced lifestyle, then ENT is for you. And if you want career that's constantly evolving and will be always present, new challenging, then think about ENT. Thank you very much. This is my presentation. If you have any question, you are most welcome to ask. And thank you very much.
الله يعطيك العافية دكتور شاكر، مقدر لك. وما أدري إذا في أسئلة من الحضور، إذا ممكن تشاركون عن طريق الشات، أو أحد يرفع يده مثلا إذا حاب نحن نفتح له المايك.
بالنسبة في سؤال هنا، بالنسبة للمعدل أو النسب في القبول، هي تعتمد على كل سنة والمتقدمين لها. ما في سنة ثابتة. أعتقد خلال الثلاث سنوات الماضية على دفعتي كان تقريبا almost 85. الكومبيتيشن كان على 85 84. السنة الماضية كان 83 80 82. فعلى حسب المتقدمين. بالنسبة للمقاعد الآن على دفعتي كانت 6 مقاعد. الآن قللوا المقاعد، صارت تقريبا 3 مقاعد فقط في منطقة عسير. إذا كان في شيء جديد ما أعرف عنه، ما أدري والله إذا بتغير السنة الجاية شيء، لأنه ما هو ستيبل، كل سنة لهم شيء معين. ربنا يوفقكم ويسر لكم.